Dr. Salwa, and I am here to make videos regarding my opinions and my experiences with my FRCPath 2 exam. So I have already discussed with you guys the some of the sections, and now the other sections I do intend to finish it off today, because I know it's been I know you guys, some of you have been waiting for it, and hopefully today will be the last session regarding the preparation. Now I know that a lot of you have come to me, approached me with a lot of questions. I have tried to incorporate most of the answers already in my videos. Now, if there is some question which you would want to, discuss with me or talk to me about, I would be happy to help you. So you can either comment on the video itself, or you can email me. And I have gotten a lot of people who have directly approached me via emails and via the comment section as well. And if I have not been able to answer you people, I am really sorry for that. It may be because I was very busy. I have been really busy with a lot of things going on. So, but anyways, this today we are focusing on the rest of the exams which we have not done till now. So now today we have already finished with the almost the first day of the exam. Now this is kind of the second day of the exam, right? So now yeah, except for OSPE 1, of course, it should be on the first day itself, right? So anyways, so what is OSPE? OSPE is something called Objective Structured Practical Examination. Now I don't know what that means, but the thing is that basically for exam sakes, you have two OSPE exams, right? OSPE 1 and OSPE 2. Now OSPE 1 is something which is kind of a Viva exam or an oral thing. There may be questions. You'll be taken to a place where with the examiners in a room, and you will be given a question. You'll be given some time to think about it, and then you have to answer them. Okay, so plain and simple. Now that is OSPE 1. OSPE 2, we'll talk about it when we come there. Now what exactly happens is that how can you prepare for this exam, right? Because this is like a question and answer. Now what kind of questions can they ask? You would not be knowing that, and sometimes you would not know the sequence of answering the things. Now, so for all that, for preparing for it, what you can do is you can attend a course. I think that is the best thing to do, is to attend the course, because when you do a course, especially for me, like I did the pathology online hub course for this one, and they give you a lot of scenarios. They talk about different situations, so at least you get an idea of what kind of questions can come, right? So you have to keep finding where what scenarios can come up, and you should know the basics of things. Like, you should know a little bit about how things happen here. What is the hierarchy? If some issue arises, I'm sure all of you, if you are working, or even if you have worked as a resident in India or anywhere else, you have on a daily basis solved a lot of problems. All of us have problems, and we have always solved it. Like, some patient has a problem or a colleague has a problem, we know how to go about it. But here, and for the sake of exams especially, you have to know exactly what the levels, how you're going to approach the problem, right? What are you going to do first, and then second, and then third. Even when it's about, say, a difficult colleague or something, or a difficult junior or a senior or a technician, when you have to deal with such difficult people at your workplace, they would want to know how are you going to go about it. So whom are you going to complain, whom are you going to tell, what are you going to talk to the person, what are you going to do on your part, things like that. Okay, so this exam is all about that. So this is not something which you will find in any book. Unfortunately, there have been no books which has OSPE exam scenarios. But yes, you have a lot of, you may be able to find more courses, but I did found Pathology Online Hub course. Personally, I think it's not too expensive as compared to the other courses, and I did online. It's online available, so it's not much of a problem. And you get an idea of things. You get an idea of how to answer the question, how to structure your question, and then you can imagine maybe more scenarios and prepare accordingly, right? So that would be the best thing to do according to me. But if you think you have a better idea, or if you can discuss it with someone else, or maybe you can get more scenarios or things like that, then of course it is up to you, right? uh, Now what you can do is you can also make notes for the scenarios, right? Why am I asking you this is that even when you're doing the course would be of some 2-3 hours or something, right? But this exam is not going to be something which you're going to prepare a lot when you're approaching the exam, but you do want to revise the things, or revise the hierarchy of say, because we don't know, right? When we are coming from another country, we don't know things, so we have to memorize a lot of things. We have to keep revising things, right? So you don't know if who is like for us, HOD is the what do you call it, the topmost person. But here you don't call it HOD, you call it a lead. clinical lead, right? So things like that, what terminology to use, how, when are you going to approach home, if this kind of an issue arises, who are you going to approach, those kind of things, those kind of hierarchy, or the buzzwords what you have to use, those kind of things you just want to revise once, I would say, before going to the exam, if at all you have time. Maybe in the last 1 week, yes, you can do it. So if it's going to be much helpful for you, much easier for you if you already have notes. Say for example, you can just make it into broad categories. Say if a question comes with which discusses about a technical error, what are the main points that you're going to do, right? Now a technical error is a very broad term that you're talking. Now the question can be maybe basically because of a scenario where an IHC stain is not working. That's also a technical error. Somewhere where an instrument has broken down and you are saying that okay, this is an issue, that's also a technical error, right? So anything which is coming under technical error, what are you going to do? Anything which is related to your colleagues, right, or their way of working, or if they're doing some wrong reporting, somebody has done a mistake, and now they can phrase the question in any way. They'll start by saying that, oh, you have to attend an MDT, and then you suddenly see that okay, this is something which is wrongly reported, and what are you going to do, etc., etc. But that's basically, if it's reported wrong, means that your colleague has reported it wrong, right? So anything which is related to your colleagues, you can make a separate column or a separate category, and you can say, okay, what are you going to do? You're going to do this, you're going to fact find, you're going to go back and check the slides. Okay, what happened? Is this the first time that the person did it wrong, or is he always doing it wrong? Why did he do it wrong? Maybe he was working too much, and that's why he made this error, or maybe he was doing something which is out of his expertise, that's why he made an error. All those kind of things you have to keep in mind, right? The points which you can say, uh, and you can make points for those kind of scenarios, right? If a colleague has done something wrong, if somebody is bullying something, if you're seeing something going wrong, if somebody is taking a bribe, if anything like that is happening, what are you going to do, right? How are you going to approach things? It may be for something related to maybe something, the slide is the slide which you're seeing is having some what do you call it, some different tissue or an unexpected finding, right? Like that it is going to be a clear case of DUB, right? Dysfunctional uterine bleeding, and then you suddenly see uh, I don't know, invasive ductal carcinoma or something. So you know for sure that okay, this slide doesn't belong to this case, but still you are seeing it. So what are you going to do? Like things like, which if we have all seen this and we have all done it and we have all solved this case at our levels. I know that if you have done 3 years of residency, you have definitely done this, right? All of us, that's a natural instinct that we tend to remove the sticker on the barcode and see the slides, and then we match it to the blocks, and we do this and that, and we see if it is anything which is a floater, or something which is a carryover from the knife or something like that. We all know how we go about that in our labs on a daily basis. But um, keeping all these points in your mind at that time would be helpful to you. And if you revise all these within in the last 3-4 days, I would say, just before the exam, you have all your points fresh and in your mind, and so that at the time of the exam, at the time of the viva, when they're asking questions, you have things to say, right? You're not getting lost. Okay, so yeah, then about making, yeah, errors, I would say, that is one thing. If somebody has made an error or you have made an error, things like that, and helping out the colleagues, and those kind of things. So all these, you have to make notes for scenarios. You can do that. If they ask me a question related to this, what am I going to answer, right? If something has gone missing, like I said, an error has happened because maybe a carryover, or maybe a floater in the slide or something like that, right? This is one kind of an error. Now another kind is that maybe sometimes which can lead to a wrong report, right? If you do not give thought to this, then you can just call it a carcinoma, and that will give you a wrong report, and it will cause a lot of problem, right? So that kind of cases, say for example, they say that okay, there was a biopsy container which has gone missing. Okay, so those kind of situations and scenarios can also be asked, and then you have to make notes again for them. So make notes, try to imagine scenarios, and in your mind, or keep asking people, discussing it with your colleagues, especially some people who are giving the exams together. You might just find out different scenarios from somewhere. And also sometimes the scenarios are given in the, when you're preparing for your FRCPath part 1, that time when you were preparing, you may have come across some scenarios. So those scenarios, also keep them in mind, and just have some points for all of them, so that you can have proper notes and just revise them before going to the exam proper. Okay, so this is not going to be a very difficult section, especially because of two things, because this is not going to be marked separately, it's going to be marked along with OSCE 2, right? So it's not like you're going to fail, and mostly there's very less chance to fail because there is no one right answer, right? You can think of anything, you can go in any way direction, right? It's not like yes, there is a broad category of how you have to go about in doing things, but even if you say for example, when you have a slide and you have, you know, that there's something, a tissue which doesn't belong there but still there, so you can, the first thing that you do is going to check the number with the specimen number, and maybe the next thing you can do is you can go and check it with the requisition number, or the next thing you can do is go and check it with the block. So even if you say one thing or the other, it is not going to make a mistake, or you're not going to be wrongly marked for it or anything, right? So basically there is not going to be a very wrong answer for it, or only one right answer for it. Okay, so there might be more than one right answers for it. So and accordingly what you say, they might ask you another follow-up question. Okay, so don't worry too much about this exam, just have some things ready, have some common scenarios ready in your mind, so that you can talk about them. Yeah, so one of the scenarios which can also be asked is where they tell you about something new which is happening. Okay, or something new has to be introduced, maybe a new person has to, not a new person, but maybe a new technique has to come. Somebody is asking you for a new test to be started, or a new IHC to be started. What are you going to do, right? So that is also new thing in getting introduced into the lab. So what are you going to do about it? Okay, so those are the kind of scenarios that's coming to my mind right now, and I hope that you can you'll be able to think of more and make some notes for your practice. All right. Also, when you're making notes for your practice, also it is good, I would say, to practice speaking. Not too much is required. You already must be familiar and good at speaking, but yeah, a little bit, maybe a little bit, just as to how to start the exam, how to start your answer, and maybe yeah, whatever, when you are speaking, the thing is that your mind should have a proper flow, right? You know what you're going to talk next, right? It shouldn't be random, like you're going back and forth, right? And it shows, because it shows. Okay, even when I'm speaking to you people, I don't have something written, and I'm not speaking from something written, right? So if I have prepared for this talk, you would know that okay, she's making a coherent sentences and she's going in one way. But if I haven't prepared for it, you would see me fumbling and stumbling and going back and forth, and that happens, right? So that happens with everybody, and that is what the examiner will also know. So try to have a flow in your mind. If you want, you can make mnemonics, right? I'm going to talk about this first, and then this, and then this, and then this. And the good thing is that in the exam, you do get some time to gather your thoughts. So use that time wisely, gather your thoughts. If you want, you can make some notes if that helps, and then go in a very systematic manner so that you can put a good impression on the examiner, right? Yeah, but as I said, you don't have to spend too much time preparing the section, because you probably would not fail the section. Nobody fails the section. The only thing of anxiety is that we don't have any books for this, right? So we don't have a place where we can actually practice all the scenarios, right? But that is not going to be a very big challenge. As I said, if you attend a course, you will be confident enough to go into this section with a lot of confidence, and you would hopefully hopefully nobody's going to fail this exam, right? The section. Now, I think I've discussed all this already, that there are no books. Try to imagine situations and prepare the solutions in your mind and in your notes, so that you are well prepared. That's all you can do for preparing, right? Now, on the exam day, as I said, that you will be given time, 5-10 minutes to think about it. You will be given a situation. Now, sometimes something they're going to orally tell you. They will give you a paper on which the situation will be written. Okay, you can take your time to read it, think about it twice. There'll be some questions written beneath it, so you can think about them. You can think about the answers, what you want to talk, right? So think about it very properly. Think about all the things that you can talk about it, all the things that you have already done. So, a lot of times it helps if you can imagine yourself there, right there in the lab, the thing happening, right? Imagine yourself being in the lab and the situation being happening with you. So I am sure you will get some points. If at all it's something which you have not prepared, just do this, okay? for all Viva questions, or for from all these kind of scenario related questions, right? Even for this exam, even later on for your interviews, if something happens where you don't know and it's about a situation or something, just go to the thing, like, just imagine yourself being there right now. Okay. Or imagine, or maybe I just hope that, if a situation comes and you have already handled it before, that the thing, if it strikes you right at that moment, that incident took place some time back, and how did you handle it? If it strikes you, then it's easier for you to talk about it, right? So yeah, so it's all about having your thoughts gathered. Okay, so that's what my point is. Having your thoughts gathered will help you clear this section really easily. Okay, so just take your time, take your deep breaths, and then start. Tell them that when you're ready. Okay, I would like to answer now. Start the thing now. Okay, you will be given 5 minutes or 10 minutes to go through that. So don't worry about it. They will wait till the time you read and you think. They will wait. No problem. So answer well. Like I said, have a thought process. Don't become random. Don't go random. For that, if you want, you can go with a mnemonic. Like, say for example, if you want to start with some very nice sentence, then have that in your mind. Speak that multiple times, so that when as you start speaking, they're impressed, right? And have the points. If you're talking about points, then describe the points, right? And if you're talking about one thing, maybe you can describe that, and then go to the second point and describe that, and then to the third point and then describe that, like that. Okay, so you can do all that. You would know best what kind of presentation you want your answer to be, right? If you're the kind of person who wants to just list 10 things, you can make an answer like that. If you want the person who wants to talk about one or two things and then want to describe those two things, you can talk about that. Okay, so that's completely up to you, whatever you feel like doing it. And like I said, there is no right or wrong answer. So if you just have to impress them, right, with your answer, and whatever you say has to make sense. That's all, right? As I said, give a good starting and opening line when you're talking about things, and there will be a lot of buzzwords, especially if you attend a course. They will tell you these things. Say, for example, patient care and safety issue. All those things are called buzzwords. So if you talk about those words, if you just throw them in your sentences and your paragraphs, they will know that you know things, right? So yeah, starting the talk would be essential, and using the buzzwords would be essential, and then keeping a structured answer would really impress the examiner, right? So those are the things that you can do for this section. Okay, now as I said, there are no books available, so I will have to jump to the next section. This is also the next day, right? So short surgical cases is how you're going to start your second day. And yeah, so this is the one which is going to be the most time taking. This is the one with the most questions. This is the one where you really have to where you prepare the most of the times, right? This is what you prepared for. Probably 70-80% of the time we're just doing this, preparing for this, right? So this is the main thing, the highlight of the exam. How are you going to prepare? How did I prepare? I will talk about that. You may be having a completely different approach. That is up to you. But what helped me, and I thought can help others, is what I'm listing here. So what I would suggest is you can make a list of your weak points, sections, weak sections, whichever is weak for you, or maybe in system-wise or system, whichever. So there might be a system which you really don't understand well. So for me, it was skin, and skin is a very important part of the exam. Dermatology, you will have 2-3 cases of dermatology in the 20 cases, so you cannot afford to make mistakes in that, right? So you have to make a list of what are your weak points are. Now I had a lot of sections and systems which are weak, and I had a lot of things which I had to work on. And so do that, make a list, and then start working on them first, because the others, say for example, if you're very good in breast, you don't have to spend a lot of time in breast because you already are good at it. You already have the knack of it. You sometimes you just have the thing for it. So you would even if it's a variant, or even if it's something really subtle, you will still be able to pick it up. Okay, so that depends on person to person. If you're very good in something, you don't really have to give a lot of time, and because you have limited time for preparation, right? So try to and you cannot leave anything. So you have to make a list of your weak sections and make them as good as the others, right? So start from there. Start from your weak points or sections or systems, and start working on them. Now when you're working on them, what I mean is that you start seeing slides, right? you start discussing the cases. Do not avoid them. Say for example, if you're in a group and they are discussing that system and you don't like that system, do not avoid it. Go for it, right? Be more participant in giving the answers and preparing the answers for them. Because what happens is that when we don't like a system, and when we are not interested, or when we don't know the answers too well, then we tend to kind of avoid it or ignore it. But don't do that, okay? Go for it, because in the end, this exam is going to give you a lot of good things, right, when you clear it. But apart from that, even if you don't clear it, what it's going to give you is a very good experience of, and a very good a refreshing, it's going to be very refreshing for your memory of the entire system, of the entire pathology, histopathology, right? So it's actually going to make you a better pathologist. Even if you fail the exam, you have actually gained something from this exam, right? That's the beauty of giving any exams. If you are actually preparing well for it, you're actually doing something really good for yourself, right? So take this as an opportunity to learn whichever things was left out, maybe because they were not there available in your residency time, or whatever happened, right? Or maybe you were not interested in it, or whatever happened, the benign things and the malignant things. Of course, don't get lost. Of course, do not do the things which are not going to come in the exam. Say for neuropathology, you don't have to go crazy about neuropathology if you haven't done it before, right? Especially if you're not planning to give neuropathology, you're doing a histopathology, FRCPath, but you don't have to worry too much about it, right? Because it's hardly going to come. Similar with bones. Now, yeah, sometimes the exams, the questions might come related to bones, but bones is not so common, right? Osteo is not so common. Soft tissue is definitely common. Soft tissue will definitely be there in the exam, but not bones, not so much, right? Again, pediatric, maybe you might just get one or two cases sometime, but usually not seen, right? So these are things which you do not have to worry too much about. Even if you're weak or if you don't know, it's fine. But other things, other systems, especially the ones that keep coming up, right? And they're very common. We all have our weak points. You need to recognize them. You don't have to be like really overconfident and say that no, I am good in all of them, right? And if you're already good in all of them, yeah, maybe you don't even have to listen to my lecture, my talks then, right? You can just go and give the exam and you'll probably be okay. Yeah? I'm sure there are people out there who are good in doing all of the things, but we are here listening and talking. Both sides are people who are normal pathologists, right? Who have only very little experience in pathology, 3 years of residency, and just started doing pathology and are interested in giving this exam. So I'm sure for those people, this is a very valid point, very relevant. You will have your weak points and systems. So please start working on them first, right? And sometimes what happens is that there are some concepts which you don't understand, right? Say for example, you're very good in gynec pathology, but you do not understand the concept of one thing, maybe, right? So just go after it, right? Just try to make clear it for yourself, okay? And how are you going to do that? You might have to study. You will have might have to look up for videos, right, on YouTube, or lectures, or talk to somebody, or see more slides, or whatever you have to do. Do it, go the length, and do whatever it takes to clarify all your concepts, right? Now is the time for clearing everything before you give your exam, right? Now is the time. So you can do all that, and that will be, I said 70-80% of the time you are going to be preparing for this section, right? So you have to uh, organize, of course, yourself, manage your time. You have to see how much time you have to give, how much you will be giving, but you have to go after the things which you are not very sure about, right? So if it is whichever system, or whichever within a system, it might be just one say one case, right, or one diagnosis which you're not very comfortable in. You're not very comfortable in making that diagnosis every time. Go after it, right? Go after it till the time you are familiar with the diagnosis and all its variants and everything, right? So yeah, just have that in mind. I hope I have been able to make this point clear, because I really think that this really helps, okay? Now when you are seeing slides, it is of course much better to be in touch with the real slides, because that's what you're going to do in the exam, right? So right from putting it on the stage, and adjusting your stage for looking at the slide, and adjusting your lenses and everything, it matters. If you're regularly in touch with your microscope, it matters, okay? It helps in your exam as well. However, I know that it is not possible for all of us to be exposed to all the systems, while preparing for exams, which would be a long time, like 5 6 months, and I'm sure that not all of us will be able to be in touch with the slides. If you are lucky enough, if you're working in a center which has all the slides, please do that. Take it as an advantage. You are really at an advantage. Do not let it go, right? Just go and see as many slides you want, whatever it may mean for you. Yeah, even if you have to stay back or come early or whatever you have to do, please do that, because it's going to really help with your exam. And for the others who will not be able to see slides, the virtuals will also help. Okay, so of course the virtual pathology leads website is one of those amazing websites which really helps you in seeing the slides. And the best thing is you can search them by diagnosis. So if you don't, if you by organ system, whichever way you want to say. Or so for example, if I'm not confident in, say, diagnosing something, maybe seminomas, so you're just going to type seminomas and I will just see all the slides available for seminomas on that website. So that's what I used to do, right? And even path presenter, you can go on that website as well. But sometimes I feel like path presenter will is not so accurate with the diagnosis, but it depends on you. If you want to refer to that, you can, but I would suggest virtual pathology leads website is the best. And especially if you're not confident about one diagnosis, go and just put it on the search, the search box, and all the diagnoses that comes up, just go and see each one of the slide, right? So that is one way of doing it. Most of the times what we do is we see a slide without knowing the diagnosis. But sometimes when I want to know the diagnosis, I mean, if I want to diagnose the case, I do it this way as well. I search it by the keyword and then I go and see all the slides of it. So the next time when something like that comes up, I am confident that okay, I have seen this case before, right? Now it depends. Now if you don't like this method of knowing the diagnosis before, then you might want to do something else. Okay, so it depends completely on you. All right. Now so that's the thing, but you have to be in touch either with the virtual or the physical. Of course physical is better than virtual, but I can understand that it might not be possible for everybody. So I just hope that you are able to find some source of seeing the slides, right? Physical. But if at all it's not possible, please be sure that you have seen the virtual slides. All right. Now as I said, whichever your weak points is, or whichever concept you don't know or you don't understand or you want more practice in it, you will find lectures related to it, right? And sometimes there'll be multiple lectures by multiple speakers, and that helps. Sometimes it helps. Sometimes the way, especially when it's about concepts and when they start telling you about it, one person may have one way of talking about it, and the other person will have another complete different angle to it. And when you listen to both of them, your mind suddenly opens and you start to see things in a better light and in a better way, right? So all that will help. So listen to lectures, and when you are listening to lectures, I know that these days all of us, we have a very small attention span. We cannot listen to long lectures, right? We tend to get lost when we are listening to lectures. So what I prefer is that I start writing notes. So when you're writing notes, it is not possible when you're making notes out of what he's saying, what the person is saying, you cannot be lost. Okay, so you are going to pick up points or whatever he says, and you are going to gather all the important points of that lecture. Of that 1 hour lecture, you will have 10 points, and that's going to help you, really help you a lot. If you do not understand, go and repeat the lecture, right? So listening to lectures, I really have benefited a lot, and I'm really so grateful to all the speakers who have put all their videos on YouTube, all the teachers, and who have made it all available for us for free. May God bless them all for these beautiful gifts that they have given to us. Yeah, right. So listen to that and make notes of them, so that it's going to help you in two ways. So you're going to listen to the lecture, you're going to make a note. You're not going to the lecture will not go waste. You will be listening to the entire thing, and when you make a note, it's easier for you to revise the next time, right? So it's going to help you in two ways. Yeah, when you are answering, so you have to be very much familiar with the latest classifications and terminologies, right? So sometimes they cut your marks even if you used an old terminology, right? So you cannot be doing such blunders, right? That will be too much of a mistake from your part. These are the things which you can really work on, right? So that's why we're doing this entire series, right? Just because for the things that you can improve on. So these are the things which you can improve on, in which you can increase your marks. So that's how you can do it. You can learn the latest classifications and terminologies, and that keeps changing. That's the beauty of pathology. right? So you will be marked. Sometimes they might accept it, sometimes they might not accept it. If it is something which is an old terminology and not used anymore, and the WHO has given a new name to it, or a new classification, and sometimes maybe you have to say, you know grading or those kind of things. If it has to be graded, it has to be graded, right? So you have to use those classifications, terminologies, etc. Sometimes if you cannot say, for example, if there's a molecular classification to it, or something has to be done by IHC for calling it the full name, to give it the full name, then you have to suggest that, okay, I will do this IHC so that I can label it completely. Say for example, in neuropathology, if you're not doing IDH1, so you're not having the IDH1 in the exam, but you can just say that, okay, I will do the IDH1. Next step is that I will do this, because so they know that, okay, you know that this is the classification, and it's important for you to label this case after doing the IHC, so you know the entire thing, and you're familiar with the latest classifications, right? So that is something which yeah, which you have to know about all the systems, okay, all the relevant systems which are going to come in the exam. Now, as I said before, that you should be writing extra information, right? For all the cases, for all the 20 cases, you have to write extra info, because really you are fighting for even half a mark, right? That's your struggle. That's your struggle for this entire 20 cases, for this entire 2.5, 3 hours. So you cannot be complacent, or you cannot be lazy at this in the section at all, right? You cannot afford to miss out on these things. You cannot afford to not practice the extra information. Okay, what I mean by that is, especially what I want to say is the previous exams, which is available on Virtual Pathology Leads website. Go through them. I know that they have not updated it after I think autumn 2020. They have not updated it, but but whatever is available, okay, whatever is the diagnosis, you have at least for those diagnoses, if you pick them out, and if you practice the extra info points, it will cover a lot of systems and a lot of cases, right? So it will ultimately, I think it will be enough. Hopefully it will be enough, but of course if you can do for more, it's the more the merrier, of course, it's better. But at least if you have practiced for those points, for those cases, it's going to be a lot of information, right? You will be able to make out, you will be able to put some or the other points for the other cases as well, right? And some points are actually general, very general, and you would be knowing them. Say for example, IHCs, when you know about a case, you know about it. Prognosis, sometimes you know about a case, if you know about it, then it won't be a problem for you to write it. But something sometimes like a syndromic association or things like that, you might not remember it, right? I mean, uh, try to remember as many. I don't know how you can do that part about remembering all the syndromes. It's actually difficult, because sometimes the associations are not so strong. The associations may be, it may be a little, what do you call it? Yeah, not so strong, basically, right? Not always associated with it, so it might not be that relevant a point for you for that particular case, right? But sometimes the associations are really strong, and they're known for it, so those things you should not miss, okay? And what else? Yeah, so these things, but say for example, the ones that are common or general for all the cases would be things like going to an MDT, or correlating with radiology, or discussing the clinical parameters with it. Sometimes the clinical parameters are important, sometimes the serum markers are important. So whichever is more relevant or important, many things you would be knowing from your clinical knowledge, from all the years of your being in the medical field, you would be knowing about it, and you'd be able to write it very effortlessly, right? But sometimes you just need one or two points which you would want to add in it, okay? So for that, I think if you want, you can also go to yeah, you can use websites. I mean, if you want, you use or refer the books, right? But please make extra info points, and maybe you can make a note out of it, at least for the previous exam cases, so that you have a lot of things in your mind, and you have actually increased a lot of extra information already, right? And believe me, those cases are enough. They cover a lot of systems and a lot of cases, a lot of diagnosis, and sometimes they might even be repeated, right? And if in case a diagnosis gets repeated, the slide might not be repeated, but the diagnosis can get repeated. And if you have missed on the extra info points, then tell me who is at fault, right? It's your preparation which was at fault, or your preparation was not complete. So as part of your preparation, you really have to do this much from your side, that whatever has been already asked, you're not going to leave on that. You are not going to be complacent or lazy about that. You are going to prepare extra info points for that. And as I said, even if that case doesn't come exactly as it is, it is still going to help you, right? Say for example, if you're doing, and of course you can always do the TNM, right? You can always add a TNM point in your extra info. Those things, when you are yeah, when you're practicing writing the extra info points for each of the cases, then it really helps you in being effortless even in your exam. That's my point. I hope I I made this points clear, because these are really important. This section is really important. And if there's anything which you want me to tell you again, or clarify it for you, please let me know in the comment section, and I will do it again. Okay, I'm sorry if I was not able to convey my point clearly. If I did convey my point clearly, then I hope that you take advantage of that, right? That you listen to it and you really follow it, right? I'm sure it's going to help you. Okay, the other thing is that it's going to be a very long section. It's going to be a really a big marathon, right? So you have to practice the time writing. It's going to be really helpful if you do this, because it is not easy. It is not easy to keep writing the entire time, and you have to add as many things as you want, right? You will be out of time, because you might think that 10 minutes will be enough, but it will not be. So please be sure that you have practiced well. You have the habit of writing answers and making all the points and writing all the extra info points and everything within that time, within the 10 minutes, right? So please make sure about it. This is completely your responsibility to make sure that you have practiced well. Okay, so these are the part of your preparation. This is how you're going to prepare yourself for your short surgical. What are the books which you would want to follow or would want to refer to? Yeah, these are the one, some of the books which are uh, they are good, amazing books. They give you a lot of information, and they are not too many pages, right? Quick reference is something which you have to keep referring again and again, and it is one of the most wondrous books, I think, which I have come across. And I don't think anybody exists, any pathologist, who doesn't refer to this book. At least the students, right, the exam goer, they always refer to this book, because it has a lot of information, a lot of tables, a lot of things, very handy, right? And Essentials of Anatomic Pathology, I personally like this book because it has got a lot of point wise points, a lot of they discuss all the diagnoses, all the points, all the cases, with a lot of points and everything. So I like this book as well. So other people, they like differential diagnosis and surgical pathology, and they like this book. It depends on you, what you want. Both of them would cover all the entire all the systems, and they would have pictures, right? So you can go through the pictures, and you can go through the descriptions, whichever you, it depends. Okay, differential diagnosis is also a very good book, because it gives you a lot of differential diagnosis for each case, and then it discusses why it is so and so and not so and so, right? So basically, if you want to know more about a system, or make some notes or anything like that, you can refer to these two books. And this quick reference, you have to, I think, keep reading. Okay, whenever you get time, just keep reading. Quick reference is going to it's just going to enhance your knowledge. Okay, and no matter how many times you read, you are going to learn something new. Okay, it's an amazing book, really. Now, other materials to study which you will find online would be, of course, the FRCPath examination slides. I said already that they have these 10 years, and each year has 2 exams. So they have put all the cases here, and they have only for 1 year they have put the short, the frozen sections and long cases as well. So whatever they have given, we can just say thank you to them, and we can just practice them, right? If they want, they can take this away as well, right? And we would not be in a position to question them. I know that it would have been great if they had added more, or the recent ones like 21 and 2022 exams as well, but they have not done it. And maybe they don't want to do it again. I don't know why is that happened. I don't know. Maybe they are not going to put more exam slides. But anyways, these are enough for your practice. If you want, you can time yourself and make it like an exam for yourself, and keep doing it. So these papers, you're not going to do it only once. You're going to do it multiple times, right? When you're preparing for your exam, you have to be thorough with all the diagnosis. Okay, some of them, especially the earlier years, They have big PDFs where they say how they have marked the exams. You have to go and read them, right? You have to know what and how is it marked. You have to know where they give you marks, more marks, and where do they cut your marks, right? You have to know all that. So these exam slides is not something which you're going to do only once, and again you're going to repeat them, again repeat them. You should know them. You have to make notes out of all the extra info points, as I said. And again, when you're approaching your exam, you can use these as your tests, right? So you can just put your timer on or a clock on and start doing your cases, right? To solve all those questions, exam wise. Okay, if you want, you can start with the latest ones first, and if you want, you can start with the oldest one first, whichever you want. But these slides, you cannot miss them, especially because, as I said, if they repeat the slide, and if you did not know, or you did not know how to diagnose it, then you please tell me whose fault is that, right? So don't do that. Do not leave them alone. This is really, really important. Okay, apart from that, of course, John Hopkins also has cases of surgical pathology and cytopathology, and both of them are good. The only thing that I don't like about this is that these are not virtual slides, these are just pictures. So in the pictures, the focus is already done, it's already focused into, you just have to diagnose it. It's like a book picture, so it is not too much of a challenge. But yes, they have very beautiful notes, very nice differential diagnosis. So those things can help you in making your notes, in making your extra info points, all those things, right? Plus it has a good collection of cases, and it's like a quiz, so you can see each case and read the history, and then you can think of what diagnosis it is, and then you can read the answer and the differential diagnosis. So it's very nicely done. And that's why people like it, John Hopkins pathology website. But of course, this is the best, right? This is the best. Everybody would know that, especially because they have all the virtual slides. This is about your practice in slides, right, in cases. This is about more of learning. If you have any conceptual questions, if you don't understand anything, a very good nice collection of cases by virtual lecture series. They started it in COVID times. It was started by CAP, and they have amazing webinars, right? And they have beautiful collection, and some of them are so great. I have listened to them so many times, and it's available free on this website. I'm sure you guys already know about it and you've already seen it. If you haven't, please go and do it, especially the ones which you find challenging, right? You don't have to go and see everything, but whichever things you find challenging, please go and see it. Okay, it's a very good source. Okay, the other one is USCAP. The other one is USCAP website, e-learning website. Now again, at COVID times, they had given us a lot of courses freely, right? So a lot of discounts and codes were shared across WhatsApp groups, and at that time I got all these courses for free. And I actually think that they are one of the best teachers around, and they have a very good collection. Those are like you're seeing live things. So I absolutely love the US Cap learning website, and their content, and their way of teaching, and the collection of cases, and everything is good about it. Again, you don't have to focus on everything, but please do focus on things which you are not so good in, or if you want to learn more from them, right? So I used the derm path thing a lot from here, and also the frozen section. I really helped from these. And as I said, for all the lectures that I learn, or all the lectures that I listen, just because I do not get lost, I keep making notes, right? So if you remember, I told you that I have notes going into thousands of pages. This is because I have listened to all the lectures, because I said I have a lot of weak points. I went and tried to clear all the concepts, listening more than one lectures. So accordingly, I have notes for each system now separately, right? And they together they become thousands of pages. But that's kind of a book for myself, for myself, by myself, because whatever I've learned, from wherever I learn, I just keep adding to it. So you can do the same thing if you want, but remember to not get lost, and to be able to revise those things, right? It shouldn't be that you're not able to revise, you're just making notes and you're not revising it. So then it will not help, right? Because when you're writing notes, part of your brain thinks that, okay, I'm just writing it down, or I'm storing it somewhere else, and I don't have to keep it stored inside my memory, right? So you might just forget it because you think that, okay, it's safely written somewhere. But unless you take out time to go and revise the notes, it's not going to help you. So be sure to take out time, and depending on how many pages your notes are running, you will have to take that much time. because not even one time it's going to help. So you have to keep revising twice or thrice maybe till the time everything is clear for you. Okay. Now more material to study. Yeah, of course, Path Elective is another amazing stuff by a group of American, I think American pathologists, where you can register for free, and you have some very nice videos, sometimes of the grossing and sometimes also of the basics. I like that. The basics, if you are sometimes, it happens that we are not so good in our basics, right? Because we have just come out so far now and so much deep into the pathology now that we do not even have the um, thing, or even the, even the thing to just go back and clear our basics, right? But if you want to clear anything, as I said, this is the time while you're preparing for the exam. Give it your all, right? Clear everything, all concepts which you want to. And sometimes the basic ones can be very very easily cleared and understood if you visit the Path Elective website. Okay, so I absolutely again love this because it has really sometimes, see for example, sometimes you might just have a problem in recognizing the different parts of intestine, right? So the small one, the large, and the different parts of small intestine, etc. So those kind of basic things, which are, or maybe the normal anatomy or things like that, you can always go back to this Path Elective website and clear your doubts, right? Also gross, I think they have some very good videos about grossing. So they have done a great work, and really, if you want, you can take use of it. I mean, you can explore this website if you want. I like it personally. Now another amazing website, of course, is iHistopathology, which I cannot stop bragging about, because this has been the best, uh, the best thing which has happened, which will happen to you for your FRCPath 2 preparation, right? So I don't know how to thank Dr. Ali for this, and he has been so nice about putting on the videos, and so clear about what where your focus should be during the exams and where it should not be. And amazing, it is just amazing. Okay, and not only for histopath but also for cytology and frozen sections. And I've already mentioned it while I was discussing those sections, that those are the best pearls that you're going to get ever for this exam. Okay, is from this particular channel on YouTube, iHistopathology. So you cannot be missing his videos. Please do watch his videos and make notes, and you will want to listen to these more than one time. Okay, so you have to keep doing that. Another amazing YouTube channel is Pathcast. Of course, you can go to their website as well. You will find the same videos on their website as well. They have a lot of they have actually a very nice collection of webinars, and they have done it system wise, so you can search it by system on their website especially, or you can search by speakers or etc. But again, now there are so many things available, but it depends on what you want. Where you are weak, you have to go and find that out for yourself, and you have to go and clear your doubts there. Okay, I'm just talking about things which is available, but I don't mean to say that you have to go and see everything, right? Histopathology, yes, definitely you should see that. Virtual pathology leads, yes, 100%, not once but twice or thrice or four times, right? But the others are optional. It depends on what you want. It depends on what you are looking for, right? These are just the things available. One person might need it, the other person might not. I needed them because I said that I wanted to do a lot of things. I had to do a lot of things. Uh, yeah, I had a lot of things to clarify for myself, and a lot of learning to do. So I actually used most of them. Okay, so Pathcast is another one, amazing one. I used it a lot for pulmonary pathology, and for even for gynec pathology, and a lot of things actually. So again, very very nice videos. Some of them you don't have to go through all of them, but if you want to find out about something, you can go on their website. They have almost all the systems, right? So it might again be helpful. Lewis Hassel, amazing person, because he makes short videos and he clarifies it so well for you. He shows you a case and he tells you everything about it, and then he tells you the differential diagnosis about it. If you send him a message or a comment on his video, he is going to reply to you. So yes, I think this is one of my favorites, Lewis Hassel's website. Now, there are other websites as well, which you might need sometimes. But one of them was this Kasant Nish's videos, and then there's one Philip Sokol. They also make small videos, as you can see here. But it depends on what you're looking for. If you want, you can see them. they will help you. Again, say for example, if you're looking out for diagnosing a case, like I said, you can go and search on the virtual pathology website and look for the virtual slides. You can do the same thing here as well. If you're looking for a particular case, you want to know how that looks, how that particular thing looks like, the diagnosis, how does it look like. Then you can go and see in these websites. They will explain you the entire thing. They will tell you, and whatever they say about the entity, right? Those are the things which you have to put in the extra info points, because these guys are talking from their experience, from a practical point of view, from what they have done in their daily work. So they know exactly what points are important, right? And the examiner is also in the same position. He also knows what things are important, right? So in this case, if you listen to these videos in the small uh, videos, right after the diagnosis, what do they talk about the case, right? Okay, if they say that, okay, this is known to be doing this is known to respond to so and so treatment, this has a good prognosis or a bad prognosis, or the surgery should be done, or that surgery should be done, or whatever they talk about it, make sure that you put all those points for your extra info points. Okay, so those will be really important points, so you don't have to keep hunting again to find those extra info points. Okay, and these will be the most relevant. So it should not be that you're practicing something which is not so relevant and you're trying to put that in your extra info points. And so because then it will not make your answer so heavy and weighted, right? But if you put the relevant points, even if it is less, it's going to give you more, going to give you a better impression on the examiner, and a more weightage in your answers. Okay, so these websites, these channels, Philip Soko and Ghassan Tranish, you can use them if you want, if you're looking for a particular diagnosis, right? If you want to know how the thing looks and what you want to write in the extra info, then you can go and see these videos, right? Okay, another one is Washington University in St. Louis Nephrology web series. This is some by nephrologists, so they are not pathologists, but they have a pathologist on board, right? Yeah, so they have a pathologist on board, and they discuss the cases in their episodes one by one, kidney cases or renal cases. But the way they describe, because those are nephrologists and they're sitting alongside a pathologist and they're talking, so the pathologist actually helps them to understand and realize the stains, this, that, how to answer the question, this, and a lot of things. So this is a really helpful website for learning and practicing your renal medical cases, which you will be getting not for short, but definitely for your uh, long questions. Okay, long cases, you're going to have it. So yes, this is one channel on YouTube which is amazing, very helpful, and you cannot not do it. Okay, you should go and see it all. It really gives you a very good idea about how to start looking for how to start looking renal biopsies. Okay, they're not I know they are a little not too small, but they will not they're interesting. Okay, the way they talk and they discuss the clinical stuff about it, it's really interesting. This website is really interesting, this channel. So please use that. Okay, use it. All these things are available for free, right? Now these are other things which are available on YouTube. These are system wise, basically, which I have arranged for you. These are also things which I frequently go and check their channels all the time, because they do amazing work. Okay, so now Dr. Rajal Shah, he's again an American pathologist, and he is a urological specialist. So he has made a lot of GUT, male genital system videos, right? And entities, and he discusses a lot about prostate and bladder and testis and all those things. So anything which you do not know, or you want to know further, or you want to add extra info points about it, you can go on his videos and see that. He makes really good videos. He makes algorithms, and he talks about yeah, even kidney. He has very nice videos about kidney, because kidney sometimes can be very confusing, and sometimes because the names are so confusing, right? And the look is so confusing. They all look so similar. All of them are pink and big, and yeah, they don't really have too much. They don't give you too much to differentiate, right? They're not too distinct from each other. But the way he explains it to you, you're going to be very, very clear after that. So I really helped from his videos about kidney and male genital system, right? So that's Dr. Rajal Shah. Dermatopathology lecture, I don't have to say about Gerard Gardner's videos, because there is nobody on who's listening to this talk of mine and who has not listened to Gerard Gardner. Okay, so I know you, all of you know about him, all of you have seen his videos, and all of us love him and his videos, and so he makes amazing stuff, right? Again, so that's one thing about dermatopathology. And then there is Dr. What's his name? I forgot his name. I think Rajendra. His name is Dr. Rajendra. I'm sorry, I forgot his name. So he has some videos. They both have some videos in common as well, from Mount Sinai Department of Dermatopathology, and some lectures of his are basically on the benign things. Okay, dermatitis things, inflammatory conditions. Okay, and those videos are again very very good. The approach, the way he approaches them, the way he tells you to see things. And as I said, that I had no experience with dermatopathology before giving the exam, and I could not leave it. So really, his lectures are the ones that gave me the confidence to even go and see the slides, and even actually start liking dermatopathology. Right, so he has again a very interesting. He has very interesting videos, and he has the best way of explaining things. So if you have any issues in dermatopathology, the dermatitis part of it, you can go and refer to his videos. Right, anything in urological pathology, I said you can go and refer to his videos. Of course, you can find your own. You can find your own resources. That's fine with me. But I'm just talking about what things helped me. Okay. Again, Sanjay Mukhopadhyay, I cannot start to tell you how great his videos are. You guys must be knowing him already, and this is one of his colleagues. I think they have a lot of videos together, Matt Giacchini, and they make amazing videos. Okay, so if you have any confusion about lung pathology, you will not be having it after you see their videos. Okay, so they have together they have very nice collection, and the way he explains it, it is just beautiful. Okay, there is no way that you will have any confusion, be it lung diseases, interstitial lung diseases, or even the approach to the cases of interstitial lung diseases, or even if it is about common things which can be asked in the exams, the common cases, the common scenarios, the microorganisms, everything. Okay, so if you have any issues with lung pathology, please refer to these two channels on YouTube, and it will be gone. Okay, so the amazing videos by these two doctors, and really impressive, really impressive, and so smoothly, so nicely explained that you will start liking lung pathology. So after listening to his videos and their videos, actually I started liking lung pathology and dermatopathology, both of them. Now there would be even more online materials to study, so there is no dearth to it, there's no end to it, there is just too much available. Do not get lost, that is my advice. Please do not get lost, because you don't need to listen to everything, right? YouTube pay, you can use Mount Sinai Department videos, and Pursue Pathology, they have a lot of videos. Telegram app, you can use that for online teaching program for postgraduate pathologists. That's one of the channels which has again one of the best teachers coming together, presenting webinars on varied topics, right? So includes all the systems of hematopath and histopathology. So this is one of the, I think, best resources which is available for us in this day and age, because you are learning from a distance, from by the bestest people, right? One of the best people with the latest things, and uh, it's just amazing. So you cannot miss this one. Online teaching program for postgraduate pathologists is just a channel on Telegram. Join it, and they will start sending you notifications about when the next lecture would be. If you like the topic, you can just attend it and make use of it. All right. They also send you a replay link, so the next day. So if you miss it, it's fine. You can just see it the other day, right? So please make use of this Telegram app. It is, there are already too many members there, so a lot of people are already benefiting from it, and you should too. Again, pathology library is something on Telegram which is has all the books. So there was this person who was asking me to send some books on one of my previous videos. So I told them as well to go and see this pathology library website, check that out, because you have all the soft copies available here, right? So there would be hardly anything which would not be available on this particular channel. So a very useful channel, and you have all the soft copies. But again, there will be too many things on the in pathology library, and you don't have to see everything. You don't have to download everything and fill up your desktop and your laptop's memory. but just stick to the ones that you want, really want. Like, say for example, cytopathology books. If you want the classification books, you can download those. If you want some frozen section books, you can download those. If you want some what is the differential diagnosis, or quick reference books, some things like that, you can download those. But you don't have to download every single thing for all the systems, because first of all, you will not get time to read everything, and second thing is, it's not even required from you to read everything. It's not too much about theory, right? You don't have to. And most of the information will anyways be available at the just at the you know just we just have to type it and search on Google, right? So anyways, it will be available. So you don't have to really um, go and read unnecessary things, right? Or too many things. It's not a theory exam. Okay, and the other thing that's available online, it's very useful, is of course the Kurt's notes, which I am hoping that all of you are already familiar with and are already using it. Okay, so again, one of the best things that we have been gifted with. These are all free, and we really should take advantage of these. Okay, and the other YouTube videos which I already showed you, depends on the system which you want to learn. But if you have any issues, you can go and discuss it. I mean, see those videos, and they are really, I'm sure that they're really going to help you. Now, coming to the exam day of the short surgicals, now this is going to be the second day and the first thing that you do on the second day of the exam, right? Now, it's going to be really difficult, one of the most difficult sections, because of, first thing is because there are so many cases there, and there's so much of pressure, and you have to see slides continuously. There are a lot of things which goes side by side on this particular section. So whenever you find yourself stuck, one thing I would say is, of course, you have to prepare well. Whatever I talked about till now will all be a part of your preparation, and you have to really prepare well. The second thing is, if you are stuck in an exam, stuck in one of the slides, and you don't know what it is, maybe you would. It's a good idea to just go back and read the history again. Okay, yeah, a lot of the times it's going to help you. Okay, there might be a slight hint to it. Now that does not mean that if you read the history and then you try to just fit in anything. Read the history first. Go to the slide. If you are lost and you don't know anything, go back to the history. It might just help you. Okay, it really helps sometimes in cytology as well, and it also helps in short surgicals as well. And the long cases, definitely it helps. Okay, so long cases, history is a must. You have to read them very carefully, but they're going to be big paragraphs of history, but you have to read them, and sometimes you don't even have to see the slide if you read the history, right? It's that always in long cases. So short cases, the history is also short, but it still might have some clue, some hint towards the diagnosis. So try to remember that. Now, know the format. I have already discussed this, how to write and how much do you want to write. Now, as I said before, if you have not written something, the examiner doesn't know that you know it, right? So you have to show to the examiner that you are well read, and you know everything. You have the full knowledge of things. You know about the latest whatever is going around, right? If there's a new classification which has come up, new grading system which has come up, you have to just flaunt and show off, right? You have to show that, okay, I know this, I know about the genetics of this case, I know about the IHC, I know everything about this case, I know if there's syndromic association associated with, I know if it can be linked to anything else. So you have to tell them everything. You can say that I know in MDT I would be knowing that, okay, this person is going to go for the surgery or for radiotherapy or for chemotherapy, right? Or if the person's prognosis is bad or good or whatever, or I would be asking this question. Okay, I would be asking them to correlate it with the um, so and so case, serum marker or something or the other, whatever you know about the case, you're going to put it down, right? And that is why the time is very it'll look like it's closing in on you. Okay, for each case you will not have too much time, because you want to write down as much as you can to show the examiner that you know everything, right? But before even starting the writing, you have to make the diagnosis, and for making the diagnosis also you need time, right? So that is the challenge for this entire section, that there is very limited time, and in that time you have to make the diagnosis, you have to read the history, you have to correlate everything, and you have to put everything together in a very beautiful manner, and you also have to write the extra info points. So that's what you have to do. That's why you have to practice a lot. That's why you have to make a lot of extra info points. That's why you need to be very familiar with all your classifications and terminologies, and your practicing should be, your preparation part should be really strong for this section, right? you might see yourself or find yourself being having pain in your hands or in your neck because you're sitting continuously, and this is the second day of your exam, and maybe you could not get a good night's sleep. That's okay because of the nervousness and etc. So you might just find yourself getting tired and exhausted, although you are allowed, or you will be given, if you want you can ask for a coffee or anything, but I don't think you will have time to go and drink your coffee while doing this. It's not a normal day. It's not like you can sip and you can think and sleep over it, right? You have only 10 minutes to do everything. So what I think is a good idea is to take a painkiller even before you have the pain. Okay, so that's what I did at least. The second day, when you have your breakfast, after breakfast I just took a painkiller before sitting the exam, because yeah, because I know that it's going to pain, right? And I also use analgesic patches. I used it for my neck and for my lower back because you might need it, because that's where it pains for me. But as I said before, you can use other things. You can use a pillow if you want for your lower back. You can make yourself as comfortable as you want with your all your neck angles and everything with your microscope and all that, right? But what I'm trying to say is that these things should not be a challenge for you, or should not influence you into getting exhausted or making a wrong diagnosis or whatever. Okay, they should not come in your way, right? So be sure that you have taken care of everything else, and now you are completely focused on your exam cases and slides, right? Now, when you are doing it, when you're seeing the slides, remember to look for the common things first. Okay, the exam questions would come first. Remember that they are not going to ask you a very, very rare thing suddenly out of the blue, right? Even if it's a very, very rare thing and you did not diagnose it, it's fine. It happens all the time, even in daily life, right? You don't have to leave the answer, but you can just make something out of it, right? You can call it whatever you're sure of. If you know that, okay, I'm sure that it's a malignancy, you call it a malignancy, and then say, okay, I'm going to investigate it further. I'm going to see IHCs to know what lineage it is. Okay, if you know that it's tumor versus non-tumor, you can say that, whatever you feel comfortable about. But remember that common things are common in daily life and in exam. Okay, so look for those first, and before moving to the second case, right? And uh, yeah, and also you have to rule out dual pathology, and there will be some things which can just be present in dual pathology in any of the cases. So you have to make a list of them. Say, for example, if you're seeing a slide, case number one, and before putting that slide down, just make a list of like a checklist. Okay, that I have already ruled it out for amyloid, I have already ruled it out for any parasites, I have already ruled it out for any other kind of dual pathology, I have already seen all the bits, I have not missed any bits. Just make a checklist for yourself, and remember to do that before keeping the slide down. Okay, and then move to the second case. Okay, so yeah, remember to do that. Also, sometimes what happens is that when you start seeing the slides, and sometimes you just start to imagine things, right? So that happens with people, and it happened with me too, especially when I was giving my first exam. You start to imagine things, or maybe you just want to correlate with the history and just say, okay, yeah, it is this for sure because that's a typical history or something like that. And sometimes you can even imagine parasites, right? So those kind of things, because sometimes they might not have a proper shape, and you might just start thinking, oh, that it may be this one of the things, right? So it is yeah, I don't know how you can avoid this, but do not overthink. Okay, if it's there, it will be there. It will be there, not only at one focus. Okay, you're not going to be very, very lucky that you saw just one focus in one slide, and you got the diagnosis correct. Okay, they're not going to test you like that in the exam. Say, for example, if you saw something shaped like a giardia, and you say, oh yeah, I saw giardia. If it's a giardia, it's going to be present in all the slides. It's all over the slide, so it's going to be seen at more than one focus. If you're seeing it only in one focus, and that too you're not sure, you're doubting it, then probably it's just not that. Okay, so they're not in the exam, they're not going to give you cases which will be present in only one focus. It will probably be in more than one focus, and if at all it is in one focus only, say for example in one of the bits only, then it's going to be really, really frank. It's really, really obvious that you will not have a doubt. Okay, so sometimes you might have it, especially in frozen section kind of things, where you have multiple bits and all the bits are clear, and only one bit is present which has got all the pathology. Say for example, of the cancer, or some fungus or something like that. So but that will be so clear, so visible, that you will not have a doubt in diagnosing it. Okay, so remember that. And it's this doesn't happen in real life, but this does happen in the exam. They're not going to test you like that. Okay, so if it is present, it's going to be present in more than one focus, and if it is present in only one focus, it's going to be really, really obvious. Okay, so remember that when you're making your diagnosis. Also remember that there'll be 20 slides, only one break in between, around 20 minutes of break, I think. So in that break, you can do eat, or you can drink, or you can do whatever you want. You go to the restrooms or whatever you want to do. But that really is the entire thing is really very stressful and exhausting. Okay, so be prepared with it in whichever way you can. So if you want to eat more before in breakfast, sometimes you would want to eat less because you don't want to feel very lazy when you are giving your exam. So whichever suits you best, do it. Okay, so but this is how the reality. Okay, 20 slides at one stretch with one break in between, and each slide you have 10 minutes. This section has the most cases. Writing continuously may get overwhelming. You need to be used to it. So that is why you have to keep practicing. And when you practice, try to do 20 cases at one sitting. Sit down and try to do 20 cases, writing them. I know it is more difficult when you're doing it at home and doing it at every day on a daily basis. It becomes very, and sometimes you might not have the time to do it. But if you can do it, I mean, try to do it, right? It's going to help you. If you are used to sitting 3 hours and seeing 20 cases in a day, or if when you are practicing, you can actually make it to 25 slides. 25 slides in 3 hours, you can try to do that. If you're able to do that, then 20 slides in 20 minutes each, 10 minutes each would be easy for you. Okay, so make it more challenging when you're doing it at home, and so that the exam becomes less challenging for you. Okay, now with each set, now the slides will be given to you in sets of 2 cases each. Now, what happens is that I discuss this in cytology cases as well. Sometimes you might have one slide, and rarely you might have 2 slides for one case. So be sure you have seen whatever slides have been given to you, and make sure you have seen all the cases. And that means each set has 2 cases, and you have seen both the cases before passing the slides to somebody else, right? You cannot be missing out on them. Sometimes some people, what they say is that they will say read both the histories together of the cases of the set, and see both the slides together, I mean one after the other, and then just write down. Okay, so you will have 15 minutes at a stretch to write down 2 cases. Okay, personally I think that's a very bad idea. Personally I think did not help me at all, even while practicing and even on the exam day. Personally I think uh, it makes no sense at all. So okay, to do that, if when you're seeing one slide, you have the points in mind and you can just write it down. Then go to the other case and see the slide and write the points down. Yes, if you've finished the diagnosis part of it, of both the cases, you have written the description, you have put in all your important points in it, you have made sure that there's no dual pathology, and you have finished the case and you have written your diagnosis. You have to now write the extra info points. Yes, then you can go on to the other case and write down that if you want at all. And the extra info points, because those are things which you're just making up from your memory, and you're just putting it from your knowledge to on the paper. So that really does not have to have a time limit, because if you then gauge that you're running out of time, then you can just make 2 or 3 points in for both the cases and then finish off your within the 20 minutes. But if you think that you have 6-7 minutes, then you can give 2 or 3 minutes to this case and then 2 or 3 minutes to that case. You can then judge accordingly. But till the time you write your diagnosis completely and you've written all your microscopic description, please do not jump from one case to the other. I don't think that will help you. But still, if you think that it is an interesting idea, if you think that this is something which you might be interested in, you can try it, but not on the exam day. Please don't do the experiments on exam day. Whatever experiments you want to do it before, okay, as part of your preparation. So when you're practicing your exam papers, when you're practicing your questions and all that time you can try it. You can do see one case and then keep it aside, and then see the other case and keep it aside, and then start writing. If you think you can remember more in that way, you're free to do that, of course, because that's something which some people suggest. But personally, as I said, I did not like the idea, and I did not find it useful as well. Okay, so you actually lose time, right? You actually don't, because sometimes you will have to put the slide again back again and then see again, okay, I missed this part, or if it was the tumor reaching the capsule, or something is happening or not, or was it going to the veins or not, or something like that. So you will have to keep going back and forth, which is not a good idea. Okay, so even if you're saving 1 second in the exam, it will count. Okay, so you are looking for even half a mark, and you're looking for even to save 1 second. Okay, so that's how your minds should be during the exam. Okay. So because the exam is so time limited and so tight, that you can give a maximum of 2 to 3 minutes to conclude whatever diagnosis comes to your mind. So as soon as you put the slide on the stage, you are going to have your mind open and all the possibilities open, and start thinking for the common things first, depending on what history you have just read, and you have to start looking for your answer. Okay. So, and just before you put the slide back down, you have to make sure that you have used all the checklists which I just said. You know, you have ruled out amyloid, you have ruled out parasites, you have ruled out dual pathology, you have ruled out this, that, and the other. Okay, so do that for every case. You have to do that for every case. So if you give 2 to 3 minutes to find out the diagnosis, then you will have sufficient time, 6-7 minutes to write down, and maybe 1 minute extra so that you can, what are the other cases may be difficult. So usually that's how it is. Both the cases will not be too difficult, or both the cases will not be too easy. So it is possible that you can save time in one of them and use it for the other case. Okay, that can happen because because this is the only time in which you can adjust, or play with. If you diagnose it early in the first 1 minute, then you're saving 2 minutes, right? Otherwise there's no point, there's no way you can save time, because you will need 6-7 minutes to write. So this is the only thing in making your diagnosis. It depends on how good you are and how fast you are and how familiar you are with things, or for the findings which you need to put in your microscopy. It depends on how good you are at all those things. So, but that's the only way you can save time, right? uh, if you are not able to do so, yeah, because it is important, because if you don't get the diagnosis, of course you don't know what to write. So that is the best and ideal thing, to do it in 2 to 3 minutes. But in case, unfortunately, if you're not able to and you take more time, then definitely you will have less time to write. So try to make that up in the next case, in the same set, right? So don't wait for the next set, but try to do it, because hopefully two cases together in one set will not be too difficult. Okay, both of them will not be difficult, or both of them will not be easy. It will probably be a mixture, or hopefully it's just easy for you, both of them, and not difficult. Okay. Have everything in your mind when you're screening. So have an open mind. Do all your lateral thinking as much as you want. Sometimes there might be things from normal in another organ, like a rest, right? Some rest in the ovaries, or in the testes, or something like that. You're looking for pathology, you're looking for cancer all the time, but it's something, just some very normal thing, and it's some unusual place. So that you have to keep that in mind. But of course you have to keep it, whichever organ you are seeing. Have an algorithm for each of the organs, so that you have at least the common things which okay, this. If it's a bladder, I'm going to rule out this. If it's a tongue, I'm going to rule out this. If it's something from this place, I'm going to rule out this. So have that checklist or an algorithm in your mind, and keep thinking about all those things when you are screening that slide, right? And one of them will strike, one of them will be prominent, one of them will be seen. And when you see that, you start writing, right? And before just concluding it, you rule out all the dual pathology things in your mind, in your checklist, and then you're done for that case. Okay, so that was about short surgicals. Now the other one is OSPI 2. Like we discussed OSPI 1, so now I put OSPI 2 here because this is on the second day, and that was on the first day. Now OSPI 2 is again the same thing, objective structure practical examination, but this is not a viva like OSPI 1, but this is a written exam. Okay, so this will be the second half of your day 2, and what happens here is that you can be given a scenario again here as well, and you'll be asked to write down what you're going to do, right? The same things which we discussed in OSPI 1 might come here, but the more common things that come here is mostly the molecular questions, or tests, or interpretation of reports, or something. They will give you a picture of something, and they will tell you, okay, things about it. Okay, so those questions will not be too difficult, they'll be very easy, but what they want to know is how you're going to handle it, or how you're going to go about it. Okay, so maybe it's an example of a cup, a carcinoma of a non-primary, and they want to know how you're going to investigate it, or how you're going to go further about it. So things like that. So know the scope, mostly about, especially about the molecular tests. You need to know how to interpret the reports, right? IHC, of course, they have asked you elsewhere as well, in long cases as well. So it is less likely that they're going to ask you IHC again here, right? Because they've already asked you that in the long cases. So what they might give you is a fish report, which will again be very easy if you, especially if you've worked in a fish lab, you know how to report it. Okay, so you don't have to really worry about it. Again, it will depend now person to person. If somebody has worked in a fish lab, they know how to report and how to interpret the reports. So they don't really have to worry. If you have not worked in a fish lab or you have not seen fish reports too often, then you will have to go about it. But you need to know how to interpret it. You need to know what this means, what the probe means, or which color means what, or what am I supposed to interpret from this? What am I supposed to understand from this? What does this mean in terms of the diagnosis? What can I give? Okay, so you'll have to work on that. So it depends on person to person what they know already and what they don't know. So again, PCR, if you and qPCR and RT-PCR, if you know how to interpret them, fine, and they will not be too difficult, the easy ones. But if you don't know about it, then you have to find out a way to know about it. Okay, so you have to work and you have to read about them. Sequencing, especially next generation sequencing, NGS, is something they like to ask, right? They did ask it for my exam as well. So if you have prepared well and you know how to interpret it, then it should be easy for you. It wouldn't be a problem, right? FCM, not so sure if they're going to ask or not for analytical testing also, but if they in case they ask, you should know about these, right? So how you prepare for this section, right? So now go to the molecular data sets, because you should know which systems would be asked here, right? Most common ones would be colorectal carcinomas, breast cancers, lung cancers, melanomas, and GISTs. So these are the most common ones which uses molecular techniques, and these are the ones. It might help you if you go through the molecular data sets of these. It might help you because the questions that will follow up and all that will you'll be able to answer them easily, right? If you have gone through the data sets. So please do that. Make notes of advantages and disadvantages of all the techniques, especially the ones that I just said, right? If they say, okay, fish versus, say, PCR, or this versus that, what is the benefit, what is the advantages, what is the disadvantages, say, name 2 advantages or 2 disadvantages, things like that. So this exam, what you're going to give is not it's not going to be in a blank sheet. It's like a booklet, like a question booklet, how we used to get sometimes in our exams. The questions are written right there, and you have a place to write the answer right there, okay, in the same sheet. And then you have another question, and you will have to write that. And this is the only section where the questions might have different weightages. So there might be one question which will tell you name 2 techniques, and that is for 1 mark. Name 2 advantages and 2 disadvantages, that is for 4 marks, because for each advantage that you name, you will get 1 mark, and for each disadvantage that you name, you will get 1 mark. So different questions has different marking, different weightage, and different everything has a place. Okay, so there you have limited space to write the answers. Okay, and on the first page itself they would have written how many questions are there, so make sure you don't miss any question. If there are 6 questions, you can go to the last page to see that you have answered all the 6 questions. Do not leave anything blank, do not miss out on any questions. You can make up your answers. Sometimes you can say whatever you want. Again, there might be more than 1 right answers in this, like in OSCE 1. So sometimes you can make things up or remember from things or your experiences and then answer them. It depends on what question they're asking, right? So it is possible that you will be able to make things up, etc. But make sure that you know about the reports, molecular reports, and how to interpret them, right? And you have make sure that you have read the data sets of these cases at least, and you know how to answer the follow-up questions. Okay, and the techniques, at least 2 advantages and 2 disadvantages of all of them, you should be familiar with that, and you should know. Okay, like it might be very simple ones, like the slides can be preserved for a long time, or it's difficult to preserve them, right? Or these slides can be it's difficult to interpret, or it's time taking to interpret, or it's difficult easier to interpret, right? Or maybe the process takes a lot of time, or the processing of the specimen takes a lot of time before this technique, or it may be a cost issue, right? It's an expensive test, or it's a cheap test. So these basic things, even if you use your mind, you will be able to use them, and you will be able to write them. But I think it would benefit if you already had made notes, so that you don't have to stress so much during the exam time. Okay, so you can do that. Like I said, you can have a note for quick revision, so you can make the notes for the data sets, and you can also have a note for the advantages and disadvantages of techniques, or the principles of how it is done, and maybe the basic things, or if something which you want to revise, anything which you want to revise, you can make a note for that. You may be interested in attending a course for this section. When I attended the Nottingham course, it included a molecular section, and I think that was enough. I did not need to attend anything else for this, but yes, I did use some online material, and I'm going to share that with you as well. you might find more material. Sometimes they're very vast and detailed, and you might it might not be so relevant for this exam, but it depends on you. If you want to know more about it and if you want to learn more about it, you're really you should do that. But I think you don't have to do too much if you have done this. Okay, so this is on a website called molecularpathologyuk.net. I hope that you know about it. If you don't know about it, then you should visit it. It's an very good amazing resource for OSP2, right? If you go to his website and if you see this, it's completely free, okay? And if you see the material, what they have given, you will not need anything else, okay? You have to be, you can be rest assured that this section is taken care of. Okay, so this website is enough in itself. molecularpathologyuk.net, very relevant things from here, and very nicely explained. Okay, so all the tests, everything is very nicely explained. So please do not forget to visit this website, and I really am so thankful to the doctor who has made this. Really, we are so we would ever be so grateful to you. Now on the exam day, as I said, that this was marked along with OSPE 1. So together, when you make your answers, you're going to pass. And nobody fails in OSPE 1 and 2, mostly because they are marked together, and mostly because there's not one answer, right? So you can have a variation of answers. So that's fine. It's a little flexible in that sense. And you have time to think and write, so it should be fine. Don't worry too much about the section. So it's not usually difficult, but you will have to prepare well, especially in terms of preparing for the interpretation of reports. Okay, that part has to be done well. Now this one, as I said, is written exam, has limited space for writing, so you have to judge what you want to write. You cannot write essays and run 2 marks. That doesn't make any sense. If it's a 6 marks question, you should write more, right? So different questions will have different marks, but make sure you answer all the questions and don't leave them. So go to the last page to see that you have written all the answers. You have written something or the other for all the answers. Okay, and you use your judgment when you're writing the answers. Now, the seventh section, or the last section, which is the gross exam, or the cut-ups, right, which is the term that is used here. Now, how are you going to prepare your gross cases? What you're going to do is, first of all, you will be reading the RCPath datasets, and you will make notes out of it. Why? Because the datasets are very, very long. They're interesting. They're like books. They're, situations. If this happens, that happens, you do this and that. But when you're approaching the exams, you will not have time to go through the data sets completely, right? So it will be really, really helpful for you if you can make notes of the important things. Just focus on the core data elements, right? What are the main things which you need to be done? What are the main, centimeters, or how many blocks should be taken? Those kind of things has to be in your note, so that you can do a quick revision, and then you can have those things in mind, and you can answer accordingly, right? How many blocks should be taken, or if there's anything unusual, or the TNMs should be revised, right? Especially of the common specimens. And if there's any classifications or new terminologies or anything which is unique to that particular system, then you should know that, right? Those things is part of your preparation. So study your RCPath data sets, and make notes out of it. Make it as concise as possible, as less as possible, because more or less we know the things. We know how to go do grossing. We have already done too many of those, so it's not like we don't know it. But this should only be for your revision and for your quick reference. Okay, so quickly, if you can go and see if there's anything specific about this particular case, or about this particular system which was written in the dataset, if you would want to highlight that in your note. Okay, so that is your preparation for this exam. Now, another way to do it is, especially if you have less time with your exam and it's not possible for you, or sometimes the dataset is extremely big, like the breast one. So in those cases, what you can do is go through the CAP template, right? Now the CAP template more or less will have the same things. Okay, I usually like it more than the RCPath datasets. I just like them more because they are so much less in quantity, right, in number of pages, and they have almost the same things, right? But when you are making your notes, or maybe if you want to download your CAP templates, you can do that. But when the first time you're doing it or reading it, do compare it with your RCPath data set, and if there's anything which is unusual, or any numbers which are different, or anything, maybe the classification or terminologies or anything, make a note out of it. Okay, so you do not want to say anything wrong or against the RCPath data set in your exam. This is just an alternative thing which I'm telling you because it is less in quantity and almost gives you the same information, right? The cap templates. So you can go to the cap templates and use them for your references for your exam, or you can use them as a note, right? But keep adding the things which you think are there in the RCPath dataset and which is differing from the cap template. So what I want to say is that you cannot say anything which is not there in the RCPath dataset or which goes against the RCPath dataset in the exam. Okay, so make sure about that. Now, if that means that you do not want to refer to the cap templates at all, then don't do it. But if you think that you can go and refer to the cap template and you can just add some notes, RCPath says so and so, then you can do that and keep your cap templates ready so that it is easier for you to refer for revision. Okay, then you can do that. So whichever is easier for you, or whichever is possible for you, or less confusing for you, follow that. Okay, so that's the part that you have to do. Now also about the gross, you should know the common specimens in and out, and I really hope that you have already know that you're already familiar with the known specimens or the common specimens, which very commonly you see, you must have seen in your residency years. Those are the common ones. Those are the breasts, so many breasts. You have seen so many kidneys. You have seen so many stomachs or intestines, or I don't know what else, breasts and thyroids. All those, these are the common specimens, right? And these are the ones that will come in the exam as well. Uterus, all those things. So but you should know them in and out, and you should know especially the unique things about it, or the unique things mentioned about it in the RCPath dataset, and the unique things which are mentioned in their TNMs. Okay, so for example, if it's a cervix, you know how many things, how complicated it is. If it's ovary, how complicated the TNM is. So you need to know what all things are there, what you would want to sample, so that you can um, you can say, I mean, what is important to see or check during the gross examination, right? So you need to be very familiar with your TNMs, so that you will not miss anything on the gross, basically, right? Prepare yourself to ask the common questions for all the common specimens. Now this again is because this is a Viva exam. Again, for all the Viva exams, I have asked you to prepare yourself to talk and to present it well, to have a pattern or a structured answer, or a method or an algorithm in your mind, so that you're not going random here and there and you're not missing anything. You can have mnemonics if you want in your mind. uh, you can make an ideal answer which you think is best in your mind, or in your way, and you can present it in that way. So if you want to say, start discussing about this, if you think that this is the best way to describe a specimen, whichever the way do you think, you can do all those thinking and preparation before entering the exam, right? So at the time of exam, it should just come out of your mouth very smoothly, very naturally, very effortlessly, so that they also know that you know the things, and you do not have to struggle at that time for words, for things, for points, and you should not come out of the exam room regretting that, oh, I should have said that, oh yeah, I did not take the weight of the specimen, or did not take the measurement of the specimen, or did not take a picture of the specimen, whatever. So those things should not be missed. So have your algorithms and your mnemonics and everything done, and your structures of your exam, everything done before you enter the examination hall, right? So that's again a part of your preparation. Now, again, as I said, the TNMs, the core data items are more important. Most important, of course, prognostic factors are important, because this is, say, for example, margins are prognostic factors, right? For specimens, most of the specimens. So you need to know that it is a prognostic factor, because you would then be careful in sampling it, right? So that's the basic idea about it. And sometimes they might just ask you directly, like, looking at the specimen, what do you think are the good, is it a good prognosis or a bad prognosis, or what are bad prognostic factors in the specimen? Okay, they might just ask you directly, or you should know it, because that's how you're not going to miss those things. Say, for example, yeah, margins, like I said in the example. Okay. You may consider attending a course for this section. I did it in a course again on Pathology Online Hub. Now, it's not a necessity. It depends on you. If you are completely confident, if you have seen a lot of cases in and out, and you have done a lot of things, especially on your own, including the difficult cases, then I don't think you really need to do any course for it. But if you think that you just want to know more about it, or maybe not so confident about giving this section, without taking a course, then you can just consider it. But it's not a must that you have to take it. Some sections it's a must, like you have to do a course before going to the exam. But this one is just fine. Even if you don't do a course, or maybe if you can do a course where it includes everything, then I think that would work out best for you, right? So the materials would be cap templates, which I used, and these were the atlases, which mostly to consider for pictures, right? Not too much for studying as much, but as for referring to pictures. So I used these books. Now it is again not completely required that you have to go through these books and spend hours and hours. You can just do your data set, and maybe if you want, you can do your cap templates, and that's it. That should be enough. And maybe one of the other book, if you want to see some pictures or anything, you can do that, right? Also, I think I have missed out, but there are some websites. Yeah, I think I have not written it here in my presentation, but there are. I will try to send the link of that in the comment section later on. But there is a couple of videos by one of the colleges of US, where they have shown very nicely the grossing of a lot of specimens and what to consider, and when you read the history, what all to think, and how to go about things, right? A very algorithmic approach, very nice structured approach to grossing. So that's really a very nice series. Not too many lecture videos in that series, but whatever is available is yeah, we can just be grateful for whatever is available for free to us, because they have done such selfless work, such good material and such selfless work. So we really have to be just grateful to them. So whatever is available, I will just send a link in the comment section about for that videos of that college, and those are helpful too. Okay, so they have chosen some common specimens, and they have shown you how to go about it. Okay, when you receive it, how you go about it, how you cut it, how you make sections, how you take sections, etc. Okay, but whenever you are seeing anything, especially which is of American colleges and American institutes, please be sure that the same things are being followed here, because most of them will be the same in UK as well. But then there'll be some things which will have a different concept or different terminology or a different way of grading them, or a different concept or things like that. There will be sometimes there will be things like that, but mostly yes, it is fine. It's always a good idea that when you're doing it for the first time, make sure you have cleared all those doubts right then and there, right? Just compare it with your RCPath data sets and stuff like that. And once you are sure that, okay, it's just the same thing, there's no conflicts, or if there's a conflict or there's something which is differently named or categorized in the RCPath, then just make a note out of it, okay? So that later on you don't have to worry about those things, because you've already cross-checked and done all your part, right? So be sure that you have done all this way before your exams, when you're practicing, when you're just started your preparation. Now, exam day, yeah, you can expect an odd specimen once in a while. So, like, we received a video odd specimen that was a valve, a heart valve. So that was something which was very difficult to even understand or imagine or see and recognize. It was very difficult. So you can expect an odd specimen once in a while, and but if that happens to you, do not panic, okay? Because that's not going to do you any good. Uh, Whatever happens, just like I said, for the OSCE scenarios, start imagining yourself right there in the lab at that moment, and then how you would go about it, just go about it that way, okay? Because we have all been through odd specimens um, here and there, and we have all anyway solved the cases, right? We know okay, what things would be important for this patient. Is it something tumorous or non-tumorous? If it's non-tumorous, you know how to go about it. If it's something infectious, you know how to go about it. What are the things that are important? Try to categorize them in those big categories. If it's something which is which has a clinical implications for the patient, then how should I sample it? If it is tumorous, then how am I going to do it? What are the important things for it? Should I sample it more? Should I sample it less? What should I do? So those things you would know. I'm sure that you already know. Especially I'm talking about odd things, odd specimens which are not so commonly seen, right? Say for example, if you get a pinna, right? Last time we got a pinna, a pinnectomy, right? The earlobe. Now, earlobe is not something which you're going to go and read before doing your exam. But if you're not going to, you should not be focusing on all the odd things or the rare things for your exam preparation. Okay, if that thing comes to your exam, you're going to handle it using your wisdom, okay, and all your experience till you have. But you are not going to go looking for rare things and preparing for rare things, okay. That's going to be really, really futile. You just have to prepare for the common things in all the sections, okay. I'm talking very general right now. When you're preparing for any section, you're just going to prepare for the common things, okay. Nobody can prepare for the rare things, because that is, first of all, it's going to be rarely seen in the exam, and secondly, it's going to increase your scope to infinite number of times, and it will not be possible for you to keep everything in mind, okay. So don't do that, it will be really futile. Keep yourself very, very focused, and keep yourself limited to what are the common things that will come in the exam. So you do not, your main aim should be that you are not going to mess up, or you're not going to make wrong the things which are commonly seen in the exam, commonly asked in the exam, common specimens, and you're still making a mistake, then it's your fault. But if you're prepared well for those things, then it's fine. I mean, rare cases, it will keep coming. Once in a while, you might just get a rare question in your long cases or in your gross examination. So you cannot, there is no way you're going to prepare for it, okay? But if it comes to you, you're going to handle it with all your wisdom and all your experience, okay? And when you have prepared well for the common ones, I'm sure you will be able to handle that as well, okay? So everybody has to do it once in a while, because at that exam time, but do not start panicking or saying anything, you know, uh, which is not relevant, okay. So if you have a pinna, you know what it is, okay, it's a cancer, or what can it be, what are the things that are possible by the look of it, and how you're going to handle it, how you're going to take sections out of it. So you'll be given a pen, marker pen to with the pictures, right? The specimens are basically pictures, and in the picture, sometimes it is more difficult to identify the organism, the not the organism, I'm sorry, the organs, you will be given a history. So when you can correlate the history, and then you can, in that specimen itself, you can then mark the places where you will actually be taking the sections, right? That's what you're going to do, and then you will give it to them with your markings, okay, to them. And they will ask you questions then related to it, and then you have to answer them. So the questions are asked, when they ask you to describe a specimen, please have a format ready, so that you can do that, smoothly, okay. So prepare well for that, and you have to stick to the RSPath guidelines. As I said, when you are preparing, you can go through the captain plates for an easier and shorter guidelines and material, but before relying completely on it, make sure that you've already compared it with the RCPath and there is no differences, okay. So usually there will not be, but sometimes there'll be, and what I find is that sometimes the number of blocks that are to be taken are different in CAP and different in RCPath, okay. So so those are the things which you have to you know see already, know already. When you're preparing, you have already taken care of those things. So either you are sticking to you have read the RC path and make notes out of that itself, or you have done the cap templates and made sure that there no nothing which is different from the RC path, okay. Whichever way you find it easy, you can do that. But when you're talking, just remember that you're not going against the RC path in any way, and you can keep talking about RC path guidelines, okay. That RC path guidelines states that you have to do so many things, so that they know that yes, you have read the guidelines, and then you are doing it accordingly, okay. Do not panic in any situation, especially because it's a YY exam. It's possible that you start panicking. Also, if you get from unfamiliar specimen or an odd one, or you're not able to recognize it, do not panic. Trust me, if you just give yourself a little thought, a little time, and take some deep breaths, and read the history again, you will be able to at least identify the organ, okay. So that's what happened with me in the valve case, because it was so difficult for me to even identify it. And then I read the history again, and it was talking about somebody taking a chemotherapy, and then she fell ill or something like that. So that was supposed to be an endocarditis thing. That was a hint. So, but if you read the history once or twice, and if you keep looking at the specimen from all the angles, you will get an answer, and you will get a way of how to proceed with it, okay. So as I said, that you can one of the things that you can do is imagine yourself right there in front of the grossing table, and doing how you do it in your day-to-day life. You can put yourself in that situation in the exam time as well, and then go about it, okay. Most probably you will not be wrong. You will at least get some of the things correct, okay. You might miss on some important point maybe, but you will not go wrong, hopefully, right. And this is one thing which you have to remember, that you cannot say, or you cannot even think that I don't know anything about this person, right? Or because I have not seen this in my postgraduate time or my residency time. You cannot say that at all. Okay, there's going to be a very bad impression. It's going to give you a very bad impression on the examiners, and I don't think it's fair also to say this, right? And because you're not going to say that, okay, I've not seen this case, so I'm not going to see it again, I'm not going to go about this specimen at all. That is not a that's not the solution to your question also. So that is not going to do you any good. Do not even think about it, and just calm yourself down, and I'm sure that you will at least get a way out of it, okay, to how to proceed with it, right? As I said, you can imagine yourself, if that helps. Okay, so that was the last section which we covered. I know I again made a very long video, but I just wanted to let everything come out, right, in the way that I can help you guys the best. So all the best to all of you who are planning to give the exams. I hope that my videos will be helpful, and I hope they will encourage you and motivate you to do your best preparation and to give your best shot. And I really, really want all of you to clear the exams in your first go. If you find them useful, like I always say, if you find these videos useful or helpful in any way, please do share it with anybody who might be in need of it. I will be making a few more videos because I've got some requests for FRCPath Part 1 preparations, so I'm going to make a video for that, and but I don't know when. And there were some requests about things after the exam, about how to go about the GMC registration or the applications or jobs and CVs and etc. So those are the next step, of course. Once you clear the exam, that will be the next step, and I will definitely I have that in mind. I will definitely make a video on that, but hopefully I will first be doing the Part 1 exam for those who are looking for guidance for Part 1. And yeah, and whoever has um, found this videos and all these useful or helpful, please do share with anybody who's in need. And thank you so much for listening to me, and thank you so much for waiting for this video to come out. Thank you so much again, and all the best. And I really hope that this all my videos and all my talks were I did not say anything wrong, or I really hope that I did not give any wrong impression to you people about anything, about the exam seriousness or the preparation or anything. And if you want to discuss anything, please feel free to do so. I'm available on my email and also in the comment section. I make sure that I reply back to whoever sends the comments. Okay, so thank you, and we will meet soon. Bye bye.